having a specific nurse coordinator for the head and neck community in a whole is vital to the patient's journey.
That's Brittney Watts from Yale New Haven Hospital. We'll hear from her later in the show. Welcome back to Cancer Buzz. I'm your host, Summer Johnson. Head and neck cancers have a heavy symptom burden that can negatively impact a patient's quality of life. But a dedicated patient coordinator can help address unique patient care needs and improve the patient experience. Our guests today talk about the patient coordinator role and how it works within the patient's care team. Angelea Bruce is a registered dietitian and oncology navigator at the Head and Neck Cancer Program at Sharp Memorial Hospital in San Diego.
With head and neck cancers in particular, they require a very interdisciplinary approach to treatment to have good outcomes. So when a patient's initially diagnosed with a cancer of, the oral cavity, the throat, the nasopharynx, that diagnosis might be made by a ear, nose, and throat specialist, or somebody along those lines. And then once that diagnosis is made, there are a number of referrals that need to go out in order for the patient to receive appropriate treatment options and care. So that involves medical oncology, radiation oncology, speech therapy, dietitian, oftentimes, of course, a dentist referral. So the complexity at the onset of diagnosis of coordinating that care is one aspect. But the other aspect is the treatments and this continued workup, especially in the beginning, is very time intensive. And so that can be very overwhelming for patients and families to wrap their head around and to coordinate, around work and family obligations. So having a navigator up front from the very beginning can really help to ensure that nobody falls through the cracks or makes treatment decisions that are not fully informed.
What are some of the nutritional challenges for this patient population?
So oftentimes at diagnosis, depending on the type of head and neck cancer the person has, they might present already with difficulty eating, with a certain amount of weight loss. They might have a history of heavy alcohol or tobacco use, which can directly or indirectly affect nutritional status. So addressing nutrition from the very beginning to ensure that patients are optimally nourished at the start of treatment, either prior to surgery or chemoradiation, can really help to improve their short-term and long-term outcomes. In addition, even if a patient is not presenting with challenges with eating or malnutrition in the beginning, oftentimes the treatment modalities will cause what we call nutrition impact symptoms, or symptoms which significantly interfere with a person's ability to eat and maintain their nutrition during treatment. So becoming involved very early in treatment can ensure that malnutrition is not a reason that treatment have to be put on hold or not completed.
Before you were a navigator, you came onto the Sharp team as a dietitian. Why was it important for you to make that transition into serving both of those roles for your patients?
Yeah, absolutely. So, because this patient population in particular has very high nutrition needs, either from the beginning or that develop during treatment, as dietitians, when we're involved with these patients, we spend a lot of time with them. So I tend to see a patient, at least once a week throughout treatment, sometimes more often. And as I'm doing that, just even focusing on nutrition, we're building a very strong relationship, developing rapport with the patient. So they might start to bring things up that are outside of the usual scope of practice for a dietitian. So they might mention they have transportation needs, or they need help applying for state disability insurance. So those are very specific things that happen all the time, that happen while I was just a dietitian. And then there was no reason I wasn't able to start to address those things initially with the navigator that I worked with, and then transition into that role myself.
How would you explain to other cancer care centers the importance of navigator programs?
I think looking at it through the eyes of the physicians, the health insurance, the organization, and looking at, what are the patient outcomes? What are the success rates? So, for example, specific metrics that I'm interested in following for myself and that I know our physicians are interested in is how many treatment breaks do patients end up having to take because, barriers or nutritional issues or symptom management is not being adequately managed. The other thing would be delays in care, from the time of diagnosis to the time of start of treatment. What does that time frame look like? And then also survivorship. What percentage of patients are compliant with following up with their multidisciplinary team as recommended by the treatment guidelines or their survivorship guidelines? So we really want to look at the whole picture, and I think those are important metrics to monitor, and will let a program know whether the patient needs are being met or not.
You've had a non-traditional background. How do you think that's helped you in this role as a navigator?
Through a number of unexpected and fortuitous events, I ended up in oncology about 10 years ago at this cancer center. And it was at a time where they had just developed a brand new role for a dietitian to be dedicated to the cancer center. So I really got to build that nutrition program from the ground up. And the reason I ended up getting into navigation or becoming interested in it is because from day one, I've shared an office with at least two navigators, always the head and neck and GI navigator. So, we were sitting shoulder to shoulder, managing patients together day in and day out. So I really started to listen to, what they were talking to patients about, what they were assessing. And it really just became apparent that this was within the scope of practice or could be within the scope of practice of a dietitian.
Next, we turn to Brittney Watts, a registered nurse and head and neck patient care coordinator at Yale New Haven Hospital in Connecticut.
The nurse coordinator role within the surgical oncology department was developed to provide support for the patient, families, just part of the disease team. Was identified that there was like a gap, and we needed to figure out a way to bridge some of the information and the care of plan for these specific patients. So within that, the nurse coordinator was designed to help navigate the patient and their families through the healthcare setting, help to establish and implement the plan of care, help to assist the patients with having to understand what was going on after the disease diagnosis.
Can you tell me more about the responsibilities of the role?
It's a multi-step process. So once we get the referral, and you have to collect data, review patient history information, and during that initial process, you kind of identify, along with maybe one of the providers, if that's indicated, you identify how the consult will take place. So depending on the diagnosis and the information that we've gathered and reviewed, it may be more appropriate for the patient to see just medical oncology, or what we often do is have a multidisciplinary consult. Depending on the patient's diagnosis and imaging review, it may be best for them to see all three disciplinary teams, which would include medical oncology, radiation oncology, and surgical oncology. So if the referral came into our practice initially as the surgical nurse coordinator, I would be the contact person for everything surgical wise if that patient were to have surgery.
What differentiates the surgical and the medical oncology nurse coordinator?
I have more background with the surgical component, what that will entail. And the medical oncology nurse coordinator would have more information for them as far as treatment plan within the medical oncology practice. So that would be like going over chemo and what that all entails, things of that sort. So it's more specialized within each group. With the head and neck population, a lot of what the nurse coordinator does is like educating. And a part of my education would be explaining to the patient what the surgical component will be. So that's like what this looks like, feels like, specifically with head and neck, a lot of the surgical, like post-operative period, the patients will look different from what they normally did. Like there's a lot of swelling. We do like reconstruction. So to go over all of that, whereas on the medical end, they may review side effects of the chemotherapy, nausea, vomiting, fatigue, things of that nature.
What are some metrics that may help justify the role of a dedicated coordinator?
One of the quality metrics that the nurse directly affects is like timely visits. So getting the patient in within a few days of the initial referrals. We also, with the expansion of our team, have been able to offer patients next day appointments. And this helps tremendously with patient satisfaction. A lot of the patients, as you know, have families and jobs and, are just living life and they need flexibility. So the nurse coordinator is able to identify some of those things and speaking with them. And the patients find that having that flexibility helps for them to coordinate how this would work within their lives. And it also helps to improve, overall treatment plans or goals. The nurse navigator, after reviewing referrals and getting patients in a timely fashion, it helps to ensure that patients start treatments as soon as possible.
Do you have any closing thoughts for your colleagues?
Having a specific nurse coordinator for the head and neck community and a whole is vital to the patient's journey within the entire process. This is the point person for the patient, for the providers. You are the connection for the patient to the healthcare facility.
Thank you to our guests today. You can head to the show notes for more resources on coordinated care for patients with head and neck cancer. This episode was made possible through support from EMD Serono. Until next time, for the Cancer Buzz team, this is Summer Johnson.
This show is a resource of the Association of Cancer Care Centers.